Hi friends, I'm Dr. Richa Malhan, I'm gynecologist and a fellow mother. In this channel, Modern Journey, we talk everything about motherhood, pregnancy, parenting and in general women's health. Today the topic of discussion is progesterone-only pills or the Minipills. So what are these progesterone-only pills or Minipills? Well, these are oral contraceptives. Just to avoid pregnancy, you can have these pills continuously, and they are useful in certain conditions where even combined oral pills are not useful. I'll tell you the difference between the two. So contraceptives are of many kinds. In this week we are talking about contraceptives one day after the other, so you can go on, I'll link the other videos below where you can check out all the possible ways of contraceptives that you can be using. Today we are talking about oral contraceptives. So oral contraceptives are the tablets that you eat every day, right? So there can be many types. The most common varieties that you have heard of, one is the emergency contraceptive or the I-pill or unwanted 72, those kinds. So these are emergency pills that are supposed to be had the day immediately after intercourse. So it has to be within 72 hours of the intercourse. But they are only for emergencies. You're not supposed to have it frequently. Right? Then you have the combined oral contraceptives. Combined oral contraceptives are the pills that you continuously take for 21 days, and then there is a gap of 7 days in which you have breakthrough bleeding, and after that again you have to take the same cycle. It just keeps repeating. So this is a very reliable method of contraception, but there are certain conditions where you cannot take combined oral contraceptive pills because they're contraindicated. So in those cases, progesterone only pills or mini pills come into the picture. So what are these progesterone only pills? These are contraceptive pills, but they only have progesterone. They do not have estrogen. Estrogen is present in combined oral pills but not in progesterone only pills. There are certain conditions when estrogen does a lot of harm to your body and you cannot be having estrogen. In those conditions we have these pills. Now what are these conditions? Number one is breastfeeding. So when you're a lactating mother, you're feeding your baby, that is the time when you cannot be having combined oral contraceptive pills. So that is the period almost a year, and in certain women they breastfeed for about 2 years. So in this period you cannot be taking a combined oral pills. Progesterone only pills is the way to go. So you're aware that progesterone only pills are known as mini pills. You often have heard the name Minipill, but there are also other brand names by which it is more commonly or popularly known as, such as Camilla, Erin, Norethindrone. These are some of the brands by which it is popularly sold in the market, and you might have heard of these names. In case you're a lactating mother, you should consult your gynecologist immediately and then go for these pills for prevention of pregnancy, because it is very unsafe for you to conceive immediately after having one baby. We have a lot of patients who even after a cesarean, within the next 6 months they end up conceiving again. 6 months, 8 months, which is their body hasn't recovered from the previous delivery, be it a normal or a cesarean. You should have an average of 2 years gap between your babies. In case you conceive before that, your body kind of it's very heavy on your body. It's not able to cope up with so much pressure that comes with a pregnancy. So it is advisable that immediately after you've had a delivery, you should start some kind of contraceptive, and progesterone only pill or mini pill is one of the best for that. Also, smoking is one of common lifestyle problems that our generation is facing these days. A lot of women end up smoking, and it's become a habit, a part of their lifestyle, and they're not ready to give it up already, but they also want some kind of contraception. So for smokers also, mini pill is a much safer, better contraceptive method than combined oral contraceptives. So you must meet the gynecologist again and consult about this. If you're smoking, then these pills are good to take. Another problem problem is again lifestyle related, is hypertension and diabetes. It is rampant these days that every household has at least one or two members who are affected with diabetes or hypertension. In case you are that woman who's affected by hypertension or diabetes already, please don't worry. You can't take contraceptive pills that are combined, but mini pills are safe for you. In which combined oral contraceptives is a complete no-no. You cannot consider it absolutely, is thromboembolism. That is, if you have any clotting problems, your blood clots, and you have any issues, any diseases related to that, in that situation you cannot be taking combined oral contraceptives. Minipill is the method of contraception that is okay with that, so you can always consider it. Lastly, if you have a history of fibroids, you've had these benign tumors in your uterus, then, or you've gotten operated for it or not operated, they're very small, they're benign, then they're asymptomatic, and you're not getting any treatment for it, or getting or already got a treatment. Either ways, with fibroids, again, estrogen will not do you good. It may in fact increase the size of the fibroid, so it's best that you switch to mini pills in case that is the problem. Another advantage of mini pills is that it reduces the risk of pelvic inflammatory disease and endometrial cancers. So that is one more benefit why we prefer to prescribe some women with mini pills rather than combined pills. Well, do you think there are only advantages to the pill and no disadvantages? That is never ever the case. All the things that have certain advantages, there are some disadvantages. In this case, the minor disadvantages are that you can have lighter periods or hypermenorrhea, like the bleeding in every period after this can be slight. Okay, one is that. Other is amenorrhea. You can have certain months where you don't have any bleeding, but that's nothing to worry. It just happens because of the pills and the hormonal shuffle, but it's gonna get all right. Breakthrough bleeding is another problem, in which you have bleeding between the cycles, but that also normalizes after 2 or 3 months of use. Initially, this is a hitch that you can get this spotting in between, breakthrough bleeding, but it will get all right within 2 to 3 months of use, and it's nothing to worry about. Another cause of concern, which is a minor side effect, is the weight gain. Some women really fear that if they start having mini pills, they're gonna gain a lot of weight, but that's again not true. The weight gain is a maximum of 2 kgs, and that also over the use of around 5 to 6 months. And so it doesn't even have to happen with everybody. And if you have an active lifestyle, it does not affect you. So you don't have to be really worried about weight gain. This is mostly water weight, and once you stop the medication whenever, then the weight will go away by itself. So you don't have to worry too much about the little weight gain that comes with the medicine on some women. Well, the major side effects. Now, this is the most important aspect. What are the major side effects with mini pills? The major side effect is depression. Depression is one of the more common and major side effects with mini pills, but again, the numbers are very, very less. The numbers are less than 1%, somewhere around 0.7, 0.8%. So you don't have to be over scared about these major side effects also. One is depression, another is thromboembolic disease. Like I was saying, that you can have this medication in case you've had a blood clot disease or a thromboembolic episode in the past. But in case you're suffering from it right now, then again, even this pill is not good. In fact, some very, very few patients have had a repeat episode of thromboembolism. So from the research, we are not very sure if this medication can cause a repeat episode of thromboembolism in your body or not. So people with blood clot disease have to be slightly careful. There is also reported evidence of stroke and myocardial infarction, like a heart attack, and to put it in simple words, that kind of problem has been reported in some women, but again the numbers are so few that it just feels like we are deliberately scaring you by such big names, but the number is very, very few. So only in case you are a person who is prone to these diseases very, very much, then only you need to be scared about it. Otherwise you can definitely go ahead and it will not cause you much harm. I myself have had these pills and had a very smooth journey using Minipills, and there were hardly any side effects, nothing actually. So it just depends on woman to woman, so you can definitely go ahead and try it. In case you have a very strong history which suggests anything otherwise, your gynecologist will tell you about it. Coming to the failure rate of Minipills is about 0.5 to 2 per 100 woman years, which is very good. Lastly, from a user experience, like from my personal experience, the only problem when you start these pills with, as opposed to combined oral contraceptives, is that one, there is no break. So you're supposed to have it every single day. There is no break period which you get in case of a combined pill. So every single day you're supposed to have your alarm set, and almost at the same time, with a 3-hour plus minus range, you're supposed to take the medicine. That is the most problematic thing, that at a similar time every single day you have to take it and there is no break. So what if the break is more than 3 hours? What if you have actually missed your tablet, forgot about it, and it's been over 3 hours? Well, you can take it immediately, but then you have to be careful. You have to back yourself up with another method of contraception for the next 7 days, say a condom or something. So, and in case you have missed the pill entirely for the whole day, again you have to do a 7-day backup. If it is more, then the backup days increase to 14 or 21 days, like that. But you cannot miss the pill. In case you miss, the cycle breaks. For the next 7 days, you have to be careful for pregnancy again and use a backup method of contraception. The most prominent way in which this pill works is it makes your cervical mucus thick or viscid. Even if that process happens, like I said, the endometrium lining is so atrophic and not ready for pregnancy that this egg which has fused with the sperm will not implant itself in the uterus, so you will end up not having the pregnancy. The last thing that I would like to tell you about the progesterone-only pills is that this is not the only progesterone method for contraception. Of course, this is a very easy to use pill method to take progesterone and avoid estrogen in case it is contraindicated in your condition or you are a breastfeeding mother. There are other possibilities also where you can avoid estrogen and have only progesterone. That is by the form of injections. For example, the Amtara injection, which is given 3 monthly and 6 monthly also. So you just have to take one injection in 3 months or 6 months. I have given a detailed information about the same in another video which I'll link down for you. You can check that out. There's also one newer and a very, very good method of having only progesterone, which is called Mirena commonly. It is actually the progesterone-only intrauterine device, okay, LNG-IUS. So this LNG-IUS is a device which we put inside your uterus just like copper T, and it releases only progesterone in your body, and you get rid of the estrogen and have contraceptive benefits as well as a lot of other additional benefits. I have talked about that in a separate video which I'm linking down. So that is all the information I wanted to give you regarding the mini pills. In case you have any further doubts, you can put them in the comment section below and I will answer them as soon as possible. Please like, share and subscribe to this channel for more useful information. Bye.